Well, we're Team Vets Against Lyme. I'm Sydney.
I'm Lindsay.
I'm Evan, and this is Sarabi.
I'm Tatiana, and this is Kobe.
And we want to talk to you today about our exciting idea to combat Lyme disease by harnessing the human-animal bond. If you're from New England, you know that Lyme disease is a significant issue here. In fact, the CDC shows that most cases occur in the New England and Midwest states, and there are about 30,000 cases of Lyme disease reported in humans to the CDC each year. They estimate this to be only 10% of the total diagnosed cases in the country. Tick prevention is our best tool for preventing Lyme disease and several other serious tick-borne diseases in people and in our pets, especially because there is an increasing number of tick-borne diseases that are becoming more common in our area. As veterinary students, we know owners are used to talking about Lyme disease prevention for their pets during annual wellness visits. We can capitalize on this existing relationship to educate owners on prevention in themselves and their pets.
Hello.
Hi.
I'm Dr. Griffith. How are
Hi,
you?
Nice to meet you.
Nice to meet you. And this must be Kobe.
Yes, this is
I can see that he looks very comfortable.
Yes.
Hi, Kobe. How are you? Okay, so you're here for Kobe's wellness visit today?
Yeah.
Great. So how's he been?
He's been good. He eats well. He runs around even though he's getting older. We try to keep him active as much as we can, like, taking him out for a long walk, like in the woods or something, like, once a day or something like that, so.
Yeah. So do you have any other concerns with him?
The only thing is that we're starting to see a lot of ticks crawling on him after our walks. Like we're seeing him like on his legs because he's pretty dark, so we can really only find him when they're crawling on his legs. So I don't know if that's something that I should be worried about.
Gotcha. Do you ever find them on yourself?
Not as often, but I think we find them on him definitely more than we do on us.
Gotcha. Yeah, so the reason I'm asking is there's a few diseases that we're worried about with ticks, one of which is actually Lyme disease.
Yeah, I've heard about that.
You've heard about Lyme? There's actually a really interesting initiative that the Department of Public Health is doing with some researchers from Tufts, where they're working to improve prevention of Lyme disease, not only in pets, but also in people. So what do you know about the disease?
I mean, I know about it in terms of like the fact that I give him like a tick medication like every 3 months, I think, and then I saw on the card that I had to come in that said I needed to get him a booster for his Lyme vaccine, and then I had a cousin that got arthritis after she got bit by a tick, but not really too much, I guess. So.
Yeah, no, that's a lot of information. The interesting thing about Lyme is it's actually very similar in dogs and people. So the tick is the same. It's actually a bacterial disease. So the bacteria is in the tick bites you or Kobe, and then you get that bacteria goes into you. So there's kind of some things we can do for dogs for prevention, like you mentioned, like the the medication, the vaccine. He looks like he is going to get his booster today.
Okay.
But there's other things you can do for yourself as well. So I'm just wondering, do you ever think about if you're taking Kobe out for walks and you're seeing ticks, do you ever think about doing tick checks for yourself or other ways of keeping ticks off of you?
I mean, this time of the year I'm wearing, long sleeves and pants, but I don't really, check myself for ticks unless, I'm seeing them crawling on me, like I see them on him, so.
Yeah. No, definitely the long sleeves can help. One thing that through this initiative we've been talking about with clients is actually doing tick checks on themselves. So when you take Kobe for a walk, you're out in the woods having a great time, you may get a tick on you or he may, so you can look for ticks on him, but you can also do the same thing for yourself, which is a great way to make sure that they don't bite you. So you find them before they kind of, do the biting thing. The other thing that you can do is you can actually spray insect repellent on yourself before you go out, and that'll help repel them. And there's also something called permethrin, which is something you actually treat your clothes with. So those are just a few things that we've been talking about recently with clients in terms of protecting themselves from ticks. Of course, you're doing a great job with Kobe. We have some information here for you. So this is just a sheet that has some summary of prevention and also just some information about Lyme disease. So what kind of signs you can be looking for in yourself, what kind of signs you should be thinking about with Kobe. And then there's also a QR code there at the bottom, or if you scan that in your phone, it'll take you to a website where it gives even a more in-depth look at these topics and can really help you think about really good strategies for prevention in yourself and for Kobe. So if you have any questions, you can definitely check out that QR code. You can ask me, of course, your medical doctor, but we're really trying to work towards defeating this disease because in this area it's really prevalent. And so one of the ways we're trying to do that is to sort of try to combine the prevention aspect of, you know, what you do with COVID, but then also what you can do for yourself.
Okay, that sounds good. Thank you.
Great.
As you can see, the wellness visit provides a great opportunity to discuss Lyme disease prevention with pet owners. A big challenge for Lyme disease prevention is providing the public with accurate, reliable, and engaging information. We need to improve Lyme disease prevention in people, and we propose to do this by harnessing this human-animal bond. During a wellness visit is a great opportunity to have these discussions with owners in the context of preventing Lyme in their pets. This would be a multifaceted education program focusing on an interactive approach. Our goals for this project are to first, develop guidelines to help veterinarians discuss One Health tick prevention strategies during vet appointments when appropriate. Second is to develop and evaluate a package of educational resources. This could include the guidelines for veterinarians, but also visual resources for waiting rooms and exam rooms, handouts that owners can take home with them, and QR codes to web material about One Health tick prevention strategies for people and our pets. People care about their pets. Our proposal builds on that relationship to improve Lyme disease education and prevent this disease in humans.